So, good evening, everyone, and welcome to the 2026 episode of the uninterrupted webinar series of the International Forum for Promoting Homeopathy. I'm Adya. I'm a third year student from Adurashramam NSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. So, today our guest is Dr. Prakash Rao. He's a PhD holder in homeopathy and is a retired research fellow officer at CCRH. And the topic today is of grave importance to the youth, to the young homeopaths, which is the need for finishing schools. Are we producing degrees, just degrees, or are we molding doctors? So it's the need for finishing schools that Dr. Prakash will be talking to us. Doctor, the dais is all yours.
Yes, sir. Your co-host, sir. You can unmute. Yes, sir. Please unmute.
Good evening to everyone. Thank you very much.
Sir,
Let
please
me share
adjust
the
the
slides.
camera. Yes.
Sir, can you see my slides, sir?
Yes, sir. We can see.
Nice. Thank you very much. Thank you. Good evening. Good evening, Pravesh, sir. I have seen everybody in the meeting. Thank you very much. Ganesh, sir, good evening. Thank you. And
चलिए सर प्रणाम प्रणाम
प्रणाम सर, नमस्कार सर. आज वेरी गुड ऑस्पिशियस डे. आज नया वर्ष का ये है, तो we will enjoy our program. And this is bridging the gap. So what is the title is Finishing Schools for Clinical Excellence and PG level lectures. So after PG level, I will go for the same type of lectures in an enhanced manner. So the core question, are we producing doctors or degree holders? What is our, why this topic came, why we are talking about this, what happened to the quality of the homeopathy, what homeopathy is needed, what are the problems that we are facing in the homeopathic education, and what are the problems that as a homeopathic doctor, physician, we are facing the problems in the society as a physician, as a homeopathic doctor. So what is what? Let us discuss. What is the educational gap? Now we are raising the problems. Then what are the solutions for this? That also we will find out in this 1 hour lecture. So theory of heavy curriculum. What is the educational gap? The theory of a limited clinical exposure and low confidence in practice. See, these are the problems. Theory of heavy curriculum not followed by the clinical exposure. The heavy curriculum is like postgraduate curriculum. Actually, in medical subjects, that is anatomy, physiology, pathology, surgery, gynecology, they are equal. And as to a MBBS doctor, but the extra subjects are philosophy and repertory. And repertorization model. See, this is a postgraduate level curriculum actually. See, now the modern medicine is treating this repertorization, holistic approach, individualization in a different 3 words. One is precision medicine, one is personalized medicine, one is genetic medicine. These all without knowing the modern knowledge, the Hahnemann has come to a conclusion that all these things will be exposed to the symptom psychology and the personality and the mind, aptitude, attitude, then we can select the medicine. So attitude, aptitude of the mind at the time of disease, aptitude, attitude of the person in general, and attitude, aptitude of person when he is healthy, by birth to death, how it has changed, how he eradicated. So these all will come under case record. And that case record is a laborious problem. It is actually a postgraduate level curriculum. And this postgraduate level curriculum also is included in undergraduate level. So naturally what happens? There will be a difficulty and heavy laborious practice, heavy laborious curriculum, limited clinical exposure. What is limited clinical exposure? When we are doing so much of work, our hospitals are not fully equipped. The inpatient hospitals are not being admitted by the patients. and if the house surgeon or the house physician is not being exposed to the OPD properly, and there are no inpatient hospitals where the beds are full, and whatever we are being taught in our organon of medicine, particularly the chronic diseases, at that age it is very difficult to see the chronic cases. As a physician, when you are an experienced physician, when you are become the senior physician, suppose I receive in my OPD, for examples, AG immunopathy, AG1 nephropathy, blastoma, lymphoblastoma, malignancy, bone marrow, after aspiration, after transplantation, WBC is increasing, how to control this. Dyslipidemia increased. Patient is unfit for surgery, how to make him surgery. These cases all we study when I am a student. But I never get as a student these cases. I will not be exposed. So there is a disparity, there is a gap, lacuna. Every experienced physician will get such a cases. So these cases have to be converted into hospital practices. Our hospitals will be at a place where they are far away located in nearby outskirts of the city. People have to go, patients have to go. Then our reputation has to be increased. Then our technicality, our quality control should be good. Then only we will get the patients. See, what is the difference between allopathic practice and homeopathic practices? Homeopathy practice is totally dependent on physician side. Though we study surgery, we never conduct surgical operations, whereas the allopathic doctors will do surgery. So their hospitals will be occupied with the surgical cases, will be attracted for the surgery, and there is no alternate for surgery in some of the cases. So that's why they will run the cases and they will have mechanism, they will earn more money. But for a physician, it will be very tough to establish himself. So homeopathic doctor will see various cases, see all left out cases, no fresh case will come to a homeopathic doctor. So a homeopathic doctor will receive very toughest cases, left out cases, untreatable cases, terminally ill cases, and one has to find success out of those cases. So that will be the toughest time for a homeopathic doctor. And this clinical exposure is not possible in our limited hospital OPD or in our hospital, inpatient hospitals. So usually what happens, wherever I go to college, getting 40 cases for dissertation work in BHMS, it becomes tough for a student to fill up the 40 cases, minimum required 30 cases for dissertation work. And it will be very tough. So, because they will not have inpatient facilities, the OPD is not equipped, the new cases won't come. So these are some of the difficulties. They have to be treated means we should have coordination with the outside doctors who are very popular, though they are practicing. When they practice free of cost, out of their reputation, some of the patients will go. So whoever can't pay money, we can request him to refer those cases to our hospital so that we will treat him as one of the physicians and we respect him so that our students will get benefit. And by this, what happens? There will be low practice, low esteem, low lack of confidence when he enters as a practitioner into the society. So usually now you will see first as a young homeopathic doctor, number one, though it is highly popular, though it is highly educated, one has to be very, very understanding person in homeopathic practice. First is, sir, do you know how to see BP number? They will ask. Number C, sir, I never believe in Indian systems of medicines, but I believe in homeopathy. Number two, they do not know the difference between Ayurveda, homeopathy, and Siddha, most of the patients. And they never bring pathological reports to a doctor's clinic. This happens usually with every doctor. That happens with me also. They never bring. Yesterday he will be discharged and he says, I am a cancer patient. They told that my father will die within 2 days. So you have to kindly save me for 15 days because my brother's marriage is there. Till my brother's marriage, my father has to be survived. So you kindly save him for a month. What is the cancer? Where from he has been discharged? Why he has been discharged? He never brings any reports thinking that homeopathy doctors may not know. This is with some. And some of the patients, the other paradoxical effect is they come with all the reports, particularly in infertility. And usually the doctors will be the patients. Then I will ask what is the mechanism of action of your medicine, how it works, how it releases the egg, when the fertilization takes place, what are the side effects of your medicines, when I can see the results. So they will search the literature, they will teach us various things. So such patients also will be present. So dealing with the patients, that's why Hahnemann told that dealing with the patient is the art of homeopathy, and the science of homeopathy is selecting the single similar remedy. This single similar remedy is nothing but a personalized medicine, a precision medicine, a genetic medicine, and a holistic approach medicine. In modern language, the holistic approach has been converted into personalized medicine. In the same thing, homeopathy has seen for personalized medicine for 250 years. Now we are going to celebrate this year 271st birthday of Hahnemann. So by 21, 24 years he started, and he invented by the age of 30 the homeopathic system of medicine. So these all will bring into low confidence while practicing by a young doctor. And having overconfidence, is also not good. Usually what happens, we as a researcher, we request everybody, kindly, you need not read a textbook, you need not open your computer, you need not open your repertorization. If you fail in a case, but you kindly read your case when you are highly successful in treating the case. So if you if you think that why you are successful, if you plan, if you make algorithms, these algorithms are nothing but repertorization, the mathematico-mechanical process of the science. That is repertorization. Now the mathematico-mechanical process of biology, algorithms, they were the small algorithms. Now we can build up different algorithms with the help of computers. So this, whenever you are successful, what is your basis of prescription? In what you are believing, why you are believing. If you are believing in a concept or in a theory like miasmatic belief, you don't have any pathological belief, or medicine will act, medicine do not act. I am not bothered. I want only symptoms. And when you are taking symptoms, when you are relieving the symptoms, you must believe the miasms. So if you refer to the miasms, the refers miasm against, if you take the help of the computer or the textbooks that are present, as there is no time, you can convert themselves into computer. So when you refer to the miasm, miasm goes to pathology, pathology goes to physiology, physiology goes to genetic level goes to genetic DNA application. That DNA application again becomes the total science, and that will become pathology. Pathology will become textbook of medicine. Medicine will become a drug. When you are giving therapeutics, there will be a cure. You can follow the case either totally on I don't say pure homeopathy, the homeopathy which you have been studied or which you are carrying out, and the other homeopathy, if you understand pathology, you can eliminate some of the rubrics. What are some of the aggravation of bronchial asthma early in the morning? There are drugs 4 to 5, 5:30, 6 o'clock, 6:30, 7 o'clock, 7:30, midnight aggravation, before midnight aggravation, after eating food, midnight aggravation. So these after eating food, midnight aggravation, after eating food, why bronchial asthma will increase? What happens to the diaphragm? What stomach will cause? These all are anatomical relations and physiological relations we studied. But though he feels discomfort after taking the food, if you come to physiology, what is that disagreeable food item that is present, which is bringing down the wheezings or cough? Number two, what is the immunomodulatory substance that is present in the food which he is taking, which is causing after food aggravation? Though he with a great systematically, authentically, and scientifically, with the help of the dietist, the patient has taken food. Despite of taking food, why he is getting a scientific food according to the dietitian's advice? Why the patient is getting aggravation? So what is the immunomodulatory effect of the food? What are the food items he has taken that you have to take into consideration? Then why he is only getting, why his brother, though he is asthmatic, why he is not getting it this time? So what is the pathophysiology? What is the constitution defect? These all you have to take into consideration and select a medicine. So repetization also helps. See, 4 o'clock aggravation, 4:30 aggravation, 5 o'clock aggravation with cough. These slightly, they all are pathological in nature. 4 o'clock, 5 o'clock makes no difference. The 4 o'clock temperature will be very low. 5 o'clock, it may come down, the temperature will be more. And 6 o'clock, it will be more. And why he is not getting a person who is getting aggravation at 6 o'clock? Why he has not got aggravation at 4 o'clock, though the temperature is less? So these have to be kept in mind. What is causing him to get aggravation early morning at 5 o'clock instead of 2 o'clock? Usually 2 o'clock to 3 o'clock, the environmental temperature will be very low. But instead of getting aggravation at 2 to 3 o'clock, this particular patient is getting at 6 o'clock. So what may be the reason why he is getting so much of resistance in the night time? Once he has been exposed, why he is getting those symptoms? We have to think physiopathologically, immunologically, medicine to the repertory to the prescription. So this is also another scientific way. This is known as personalized medicine. You need not go for genetic tests. Even after going the genetic test, for example, what is the DNA? What are the chromosomes that are bringing bronchial asthma? And what happened? So it is our duty to produce changes in DNA. How to change it? We should have laboratory. Then how to show it? Then it will be a tough time for a practitioner who settled at district headquarters to undergo all these things. So what is his aim? Relieving the symptoms, not getting the symptoms, delaying the acute aggravations, and delaying the postponement of the cough in such cases. Just like I gave the example of bronchial asthma, you can take it to peptic ulcer. You can take all the symptoms of physician side that are from peptic ulcer to tonsillitis, acute sinusitis, chronic sinusitis, chronic otitis media, otorrhea, where it will leads to deafness, buzzing in the ears. Then go to the eyes, conjunctivitis, skin, dermatitis, atopic dermatitis, psoriasis. There are so many cases. See, lichen planus is curable in homeopathy, and it is a viral disorder. But how many cases are being presented? If you refer any for article, you won't get. But nobody has done the statistical data. So there you will feel as a practitioner, as a new practitioner, the lack of confidence will come. They have to be taught in colleges. Colleges are having defect. Then what is the solution for colleges? You will come and see. You will see in my future slides. So postgraduate clinical refinement program, bridges of academic practice. Bridges academia means whatever the knowledge that is being imparted, what are the CME programs. So they have to impart the knowledge. And the postgraduate clinical refinement program, they have to get together of the students who are in postgraduate level, and you have to educate them. Once you educate them, you have to expose them. If there are no patients in particular homeopathic hospital, where are the patients present and what they are doing? Take them to a tour, an excursion tour, an education tour to a hospital. If the Kerala Thiruvananthapuram government homeopathic hospital is there, take permission, take them to the one week to 1 month program, show them the case and how to treat, and give a plan. Give a plan. Usually what happens in homeopathic practice, suppose a case came to me, I gave Naxwamika. Immediately the case in my OPD goes to other doctor on other day. So he, instead of giving up Naxwamika, he gives phosphorus. So phosphorus and Naxwamika not goes hand in hand, they are not related. Why he gave phosphorus, he never writes. Why I gave Naxwamika in my OPD, I also never write. So at the same time, you will see what we find in our survey studies is, usually when we enter into the government OPD hospitals, when we sit, so if a homeopathic doctor gives some medicine, these all senior doctors knows very well. But being this is because it is an educational, it is a where we have to rectify, we have to give some of the policy making to the government of India. That's why I'm talking in detail. See, usually I found in colleges, and it is also present as a senior doctor, as a researcher, we never take it into as a, because success only comes with hard work, sincerity, and skill. So when one achieves the success through that, by blaming somebody, by criticizing somebody, they don't achieve anything. That only will spoil the future of the homeopathic academia. So what happens is the other doctor says he do not know. He gave Naxonica. You give phosphorus, and phosphorus he do not know anything. So basically the patient prescription goes what we found. In his cases, he thinks that he is master, but in others cases, he thinks that the other doctor is wrong. That's why I have to prescribe. So in clinical practice in government hospitals or in private hospitals, where they are associated with the colleges, they never make a plan. Why suppose a chronic case came, a bronchial asthma case came, because the bronchial asthma cases, allergic bronchitis cases, upper respiratory tract cases are more in every hospital. I am not talking about the cancer case. You have to apply this plan even to cancer cases. So when that particular doctor has done work, that he want to give Naxwamika to a person of bronchial asthma, think like that. Why he gave Naxwamika? What are the symptoms he noticed? He need not take an elaborate case of 36 pages. But what made him to, then there will be a house surgeon. The house surgeon will be asked to open repertory. Nowadays, repertories are available on smartphone. So they can see, they can write the repertory number, Kent repertory or complete repertory or something, the rubric, so and so, so and so. One hint, because he will not sit in the OPD for next week. So the other doctor will come. So he has to plan for him. Number one, he needs 6 months to 1 year treatment. He is a status asthmaticus patient. Today, how to manage him? Today, casualty, if night time he comes, somebody tells to that patient in asthma clinics that homeopathy is being cured. Why he will be informed that homeopathy is being cured? Usually, actually, homeopathy has worked on some patient. So that patient mouth-to-mouth publicity is more important in homeopathy rather than on TVs and YouTubes. So that mouth-to-mouth publicity, because the other patient will give assurance that you go to this doctor, you go to this hospital, he definitely will cure you. So when he comes with so much of confidence, it is a part and accountability on the doctor to notice the symptoms and to give guidance. See, first Naxwamika, I gave it as a general antidote. And just for example, I am telling. The second thing is, I want to give next arsenical. Arsenical, I want to give up to 200 potency, because in my experience, I found that 200 potency in chronic asthma cases may not work. Then gradually I want to go to carbo, which depending upon the change of the symptoms. If carbo which never works, I will go to natrum sulf. If natrum sulf not works, I will go to tuja. If tuja never works, again I will come to arsenical. One has to see the complementary of the medicine, relationship of the medicine, antidotes to the medicine. Whatever this first physician gave, it should not become antidote to the other. So patient should have coordination. The physician should have coordination. This coordination is not present in any hospital. So first they have to coordinate themselves. If this coordination could have been brought, we could not have faced the consequences what we are facing today. From the time the homeopathy has invented, even in those days, see, I will just funnily, I will tell that recently in a seminar, both the homeopathic doctors quarreled on the dais, and they have exchanged they wounded each other. So this is the status of homeopathy. How you give, how you selected miasm, why you selected, there are no border demarcations. But at the same time, if you plan, it will go to next physician. What happens with the planning? See, I will refer the cases from my homeopathic hospital, from my private clinic to Jipner and other hospitals. I will give them a chit. Go to the so and so hospital. I will write. For example, there is one senile leukorrhea. A woman came to me, a 72 years old woman came to me, and she told that I am feeling awkward to tell that I am getting leukorrhea, and it is giving awkward smell. When she entered into the room smell also changed. So one final trick is, senile leukorrhea at the age of 72. That means malignancy. So I told, okay, I will give you, but within 1 week, you kindly go to this gynecologist and you kindly show. Usually, the allopathic doctor will be short tempered when they think of homeopathic doctors or any other doctor because they do not know. But most of the homeopathic doctors are very popular by name among the allopathic doctors because they take treatment from them. So I will put on my OPD sheet, examination done, so and so, so and so, so and so, senile leukorrhea, reference, the gynecology textbook of so and so, so and so, Davidson textbook of medicine, one symptom, and senile leukorrhea, maybe malignancy, refer to this doctor, one question mark. So on seeing this case record, definitely the allopathic doctor will get his egoism hurt because I have written malignancy, maybe malignancy, but I have written that refer to higher institute, refer to this particular doctor, and kindly requested with the doctor, kindly see and examine, kindly treat from your end. So when she sees that it is malignant, she criticizes me, she feels egoistic, she feels senile leukorrhea, it is definitely malignant. But however, when she sees the word below that refer to this particular doctor and take the treatment, her expert consultation, she will be very happy, she will examine and she says that you are suffering from cervix cancer and then you have to take this treatment, then the treatment they will undergo. Then what happens? They will give radium therapy, chemotherapy, something. The patient, because it was diagnosed by me, patient will come back to me after 3 months and they will see for recurrence after 3 months, recurrence after 6 months, recurrence after 1 year. So it becomes the responsibility of the homeopathic doctor. The cancer never recurs again. Then we have to do our homework and give the medicine. So 1, 2, 3, 4, 5 cases over. Childhood asthma cases. Sir, we are taking homeopathy. He told that the child will get acute attacks once in a year. As he told, sir, this child never got. I used to come to Jipper hospital regularly. From the age of 5, this is the second year I am coming. And from last 1 year, he never got acute attacks. Now he told as patient age is increased, once the treatment follows for 2-3 years, his wheezings will disappear. Then that doctor laughs at me and doctor thinks that I am good for nothing. Gradually he sees effect. So one day that children doctor came to me. See, you are treating so many cases. Who are you? I want to see you. I told them I am a physician. I know that it will be possible. No, childhood asthma is incurable. I told that, sir, why you came? Just to tell childhood asthma is incurable? Or what you came? You are praising me that I am taking up and managing the cases. He told, yes, you are managing. Then he asked how your medicine will work. Then can we depend? Then I told, sir, if you have interest, we can have a integrated study. And childhood asthma is curable in homeopathy. We studied in our lecture. We studied in our textbook. And in your textbook, it will be written. So your textbook will change because our textbooks, there is nobody to change it. And if we are not in a position to cure cancer, so we are agreeing, we will refer the case, but at the same time, we will see that the cancer should not progress after the treatment and recurrence has to be delayed and the quality of the life has to be improved. So we are looking out and one day you will turn behind me and you will come. And the same thing happened. We had a study on childhood asthma cases and study found to be excellent and successful. Then all allopathic doctors became my close friends. But for this, you should have tolerance. So what you have to do is clinical refinement programs, bridging the academia practices. See, we should not think that allopathy is against us. See, whether allopathy, homeopathy, our aim is to treat the patient. How to treat the patient? So usually what happens when we have taken up survey, number 1 is a physician goes to opposite to other homeopathic physician. Number 2, talking again is the allopathic system of medicine. The allopathic system of medicine is having side effects, bad effects, contraindications. The private practitioner is minting money. Whether he mints money, he don't mint money. The patient came to us after being failed by the doctor, that allopathic system of medicine. So we are definitely great. Why we have to criticize him? Then we have to apply the treatment. We have to tell that the doctor may be bad, but the science is not bad. So you kindly may need the help of that science at any time, because I am also not permanent and my hospital is only permanent. And he needs a patient of 22 years is coming to me. I am already 65. So if I die, who will look after the patient? So some of the complications he developed, we have to do long-term planning of the patient. So we have to write a beautiful case record, then planning, then going to the drug, then taking the case sheet and taking that Xerox if possible. If the case needs our reference, going to home and doing homework and seeing for success of that particular case. Then competency is pyramid. First is knowledge, second is skill, third is clinical reasoning, fourth is independent practice. See, knowledge is most important. Some of the colleges are substandard colleges, but they are giving degree. So in our first slide, whether they are degree holders or whether they are doctors, whether they are qualified fools or whether they are qualified quacks. So this is our question in other words. So knowledge is properly imparted, there will be professionalism. When the professionalism is practiced, it will become skill. See how a motorcycle mechanic will do. He cannot break one by one. He has to open each screw. Then only the engine will come out. In the same fashion, knowledge will give how to open the screw. So that knowledge is not being imparted theoretically in the colleges. But who has to catch them? The physicians who are treating, the teachers, the professors, the assistant professors, the administration of the college, they have to feel guilty whether they are giving proper knowledge to the students who are believing in coming and who wants to become best homeopathic doctors in the society. I should not do any impartiality or anything wrong while I am educating a student. So I have to give at least my theoretical knowledge, at least anatomy knowledge, physiology knowledge. Absolutely don't require any practical education. See, one book is sufficient, either physiology or anatomy or total materia medica or total organ of medicine. If he is thorough with these theoretical rhymes, like a student in first grade with rhymes, and he will build up his practice once he comes out of college. If the college is not thorough or not fully equipped, the infrastructure is not up to the mark, at least the theory level of education is good in particular subject out of these four subjects: anatomy, physiology, materia medica, and this organon. Materia medica will make him to develop his own repertory. Then materia medica also will tell that when he reads that there will be written in one of the materia medica, the psoriatic constancy, then he is perfect with materia medica means he refers what is psoriatic constancy. Then sora is in mental itch. Then he thinks that how mental itch will come. That is a genetic instinct. Then he thinks of genetics. When he thinks of genetics, he thinks of DNA. When he thinks of DNA, he again comes that how this DNA is bringing out the pathology. What are the demarcations of the sora pathology? So psoriatic, one word in materia medica will make him to get knowledge of all five subjects, and he will develop skills, and that skills will make him to clinical reasoning. Why this particular patient is developing bronchial asthma in the family? Why other five children are free? If he is getting, why he is getting? So clinical reasoning, he will think of his materia medica, his pharmacodynamics, his pathological knowledge. He thinks of immunology, then he develops his knowledge and he will open independence practice. So the college should have infrastructure at least in one of the subjects of these four subjects. You leave him to practicality. You at least the theoretical part of swimming, you kindly make him to learn. Then he will jump into the water, then he will remember his theory and he swims. So these are the lacunas in our colleges, and they have to be improved by postgraduate clinical refinement program, bridging academic gap in academic distance in between clinical practice and knowledge. So knowledge, skill, clinical reasoning, independence practice. Then UG, undergraduate courses, internship, finishing the school. When internship is finished, what they learn, how they are going to do, where they are going to practice. You have to take 1 or 2, 3 days class. This particular presentation is not present in homeopathic colleges. But even in allopathic colleges, even today this practice will be done. They will be given an Hippocratic oath, where we are not giving, we are giving Hippocratic, we could give Hahnemann oath. The physician's and only mission is to treat the disease as it is cured. So, what you are going to do, whether you have any idea, then how you are going to make classes, then you will be always confused. So, you kindly come to my clinic as a teacher. I will give you the cases. I will teach about the cases. You also learn from me and make him independent. Now you learn him, you make him to learn the practical part of the swimming which you have taught in your college. If the college professors, if the college physicians, if they spare around 3 months, 1 month time and leaving their clinic on their students whom they believed, whom they want to come up, and taking work from them and taking their clinic also to improve, that make him to write the case record, daily 1 case record, that is sufficient, and teach him that 1 case record, and you make him for 3-4 months, then he will have his own practice and he will do wonderful practice and he will get competent, he will become a competent physician. This approach is still present in allopathic hospitals, among allopathic doctors. See, after passing from this one, they will go to head of the department, they will tell their problem, then he says, I am referring you to this physician, he needs some assistance, can you spare little money? If you can't spare, he will give you packet money. You kindly go to that particular village or town. You stay there for 3 months. Then he will be taught and his brain will be washed. He will become a complete physician and he will go to his village or wherever he is located and he will do his practice. So, clinical modules, case taking, repertorization, remedy differentiation, follow-up analysis. These were taught very well in our homeopathy colleges. This is the overburden of the courses. So, what government has to do? Government has to do it as a semi-postgraduate, a condensed course of postgraduation has to be introduced in homeopathy, not BHMS, MD in homeopathy after completing intermediate, after the NEET, then they have to give a direct homeopathic studies, they have to make him a direct homeopathic physician, and they have to give him MD qualification. This BHMS qualification, case taking, BHMS and duration 5.5 years, repertorization, BHMS remedy differentiation, BHMS follow-up analysis is not possible in 5.5 years. But our machines, our think tank won't understand this because their environment is entirely different. They think that if we do this also, if I do that also, see, it makes no difference. But whereas this is being practiced in allopathy and they will train their students, that's why you will find, because most of the people are from Kerala. See, the Calicut Medical College, popularity is popularity, reputation is reputation. See, why Usmania Medical College? Why the popularity from Hyderabad? Why there is, see, All India Institute of Medical Sciences from Delhi? Why they are popular? Why they are bringing because they bring out their students in such a way, they will create a module and their students go outside, means they will be successful physicians. This follow-up study has to be copied in homeopathic hospitals, in homeopathic administration, in homeopathic colleges, which we have to refer these modules to our homeopathic mission so that they will learn and they will impose this. And assessment of framework, what is the work that are being done? See, I have seen in any college, this will be written in the textbooks, in the sense the curriculum. The log books for students and teachers, there are no log books. There are no case presentations, case records. See, the patient in a very good, suppose, homeopathy, either in Kerala or in Hyderabad, J. Surya Medical College, or see, in Tamil Nadu Medical College. See, patient is being admitted, 36 pages of case report has been written, and everything is present, but the in Vivavos and clinical case presentation, we don't find a 5 years old case record. The patient is coming on. The patient will be admitted from the hospital. He will be discharged. He will be asked to attend OPD, but his case it will miss. Whereas with allopathic hospitals, it won't be like that. Patient came 5 years back. He will have a book and his OPD is today, and that will be entered into that book. And any physicians who is going to practice, see, they have only 5 to 10 drugs. They have to give those drugs, and they have to change the drugs if the system has improved. But in our homeopathy, the planning that has been done previously, that will not be followed by these homeopathic doctors because the professional culture is not present. Where this professional culture has to come. And clinical audit. Clinical audit means what is the success rate? Since how many years patient is coming to us? Then why he is coming to us? If he is coming to us, what is the ratio of improvement? These type of studies are not being made in homeopathic case presentation and clinical audit and house surgery. So, and Vivavos, when the physician is going out, asking him, telling him brief notes, telling him the key points, telling him the key points in Materia Medica, making him ready to have a perfect physician outlook, and he has to be ready to open his clinic. But he will go here and there, pillar to post. He won't learn anything. These are. Then how to solve these problems? See, institutional centers, mentorship models, public-private partnerships. See, you have to do public-private partnerships. You have to take help of. See, most of them, I am seeing in this group, most of them are private doctors. See, the private doctors having so much of interest to have a association and have lectures and have support of the improving of their knowledge. But what happens to government doctors? Number one, either they are busy, or number two, because of they are working in the government, they need not learn. They will be under the opinion that they need not learn, and they do not know what they are doing, and they will be always busy in asking for their rights instead of doing their duties. So the public, why a private practitioner you have interest in coming, and why your practice is too good? The reason is you want to know the subject. So you want to improve the quality of the homeopathy. So mentorship models, public-private. So these are one of the slides that I have finished. Now I'll attach another group of slides. Please. Sir, you have to give me permission. Share is possible. Sir, I will just switch on.
Oh, sir.
One minute.
Sir, your co-host, sir. You can do it, sir.
1 minute, sir. Yes, sir, I'm doing. Then KPI models, cure rate, patient satisfaction, diagnostic accuracy. This has to be carried out by our homeopathic educational group, which is having homeopathic mission, the Center for Homeopathic Mission of New Delhi and CCRH. Both have to combine. The cure rate has to be assessed in our hospital. Patient satisfaction has to be seen. Wherever there is a hospital that is carrying out the OPD and the institutional training, and the diagnostic accuracy. What is the diagnosis? Why diagnosis? Mere diagnosis is not sufficient in homeopathy, but the mere diagnosis is a scientific part in allopathic world. So mere diagnosis is curable by our homeopathic way without knowing the diagnosis. That's why we have to see the proper diagnosis, and we can take the case record depending upon the symptom similarity. Later the diagnosis automatically comes. Then we have to show them before treatment and after treatment. During treatment we will carry out in research, but in colleges it is not needed. How the patient has improved, how the patient is going to improve, and why, what is the plan, how medicines have been given, and before going to medicines. See, though the discipline has been taught in homeopathic books, but that is not being followed accurately during the house surgeonship by the teaching physician or by the house physician. So, policy proposals. National Physician School Network. See, the homeopathic mission, the Commissioner of Homeopathy and the Commissioner of Homeopathic Education, even don't think otherwise. I am sarcastically comment, but they never think that National Physician School Network What is that national school? See, what is that? What they have to do? So what they have to, how to combine, how to coordinate with one college to other college? What is the accreditation? Now accreditation is coming, but they do not know the finishing school network. They do not bother about the final year students and house surgeons. And house surgeons also never bother anything what they learn. They think that it is a leaning period and roaming period. Whether the house surgeon is being paid stipend or not, they will worry. At the same time, college education also never worries. And 1 year before the house surgeon, that is 4th year, the finishing school network is not possible with the Commission of Homeopathy. And they have to build up, if they want to build a good product, forget about the first year, second year, third year. And you bring the total work at the finishing school network. You incorporate, you have 108 approved bachelor colleges and giving undergraduate degrees, and they have around 69 postgraduate colleges, and they have around 5 universities giving PhD. But you will laugh at me, the PhD coordination is not present, the PG coordination is not present, the undergraduate coordination is present, not present, and our Commissionerate of Homeopathy, the education wing is also not knows that they will have a finishing school atmosphere of the each college. See, yesterday I attended one meeting on 12th of March. I have seen the second year college MBBS students of South India seminar. See, what is the curriculum that is being taught in Kerala? What is the curriculum that is being taught in Pondicherry? What is the curriculum that is being taught in Vijayawada? So there are so many colleges they found. Then they told that for so many colleges we cannot do this. From each college we will take 2 students and we will bring all the colleges. And 2 students, there are 1,000 students. That means there are almost around 50 colleges. So only second year students, and for my surprise, only the second year subjects have been discussed, and the second year subject case presentations were done, and second year case presentations of the knowledge has been done. This process is not known to our Commissioner of Homeopathy. So they have to build up the finishing school of network. Then CHS are led accreditation. See, so many seminars are being carried out. The seminars quality of the control. But CCRH people are very busy that what work they are doing, they want to explain. Instead of what work you are doing, how to quantify it. See, this is the trouble with our CCRH people. I am doing research, you kindly listen to me. It is your duty to do research. Research is not needed for 4th year boy. Research is not needed for a teacher. Research is needed when the application goes into the market, when a patient has to give without why reproducibility is not coming if your research is up to the mark. Why the potency selection is not same around the country. You work on that, but they never work on that. They will say that we are doing this research, you kindly listen to me. A final year students, he will be struggling for his settlement of his life. A teacher, he has to teach. The research, see whether the allopathic doctors knows the pharmacology of the paracetamol that is working in the body. He do not know, and he need not know. Because it is the research work, they will tell that this is this, authenticated, patented. Brought this is the literature. The literature of the book will be included in next year, therapeutics. There ends the matter, he will read the book. So that's why what the home doctors will tell, the whatever 10 years back I learned my MD, nowadays it is too good. So you go to a young MD doctor, he will give the other things. At that time, our antibiotic used to be different. Because he don't have time to read and learn about new antibiotics, and he will be very honest. So here, the National Finishing School mechanism from our Commissioner of Education, Homeopathic Education in New Delhi, the Homeopathic Commission is not following. They do not know. I have sent so many proposals. I will send my proposal to you. You kindly send through your organization, my dear Ganesh sir. Then CCRH led accreditation. CCRH is busy in trumping their own beats. They beat their own drum. They never tell you what is accreditation. Who are you to conduct the seminar and giving accreditation? Have you got permission from us? Have you got permission from National Commissionerate of Homeopathy? Then accreditation should have this knowledge. Accreditation lecture should be of this standard. Accreditation standard should be different. And you have to teach only, you have to take that seminar. No, call anybody and give accreditation. It will depend upon the principal's hand. And they will carry out on the paper. And a person will be called and he will be given a lecture of case presentation, case taking. There ends the match and 5 marks. See, and funding support. They all talk, but the government of India never funds the colleges. This time the funding has been less. So these are the difficulties. Then what is in the conclusion? From degree to competence, from knowledge to healing. The National Commission of Homeopathy has to take till this date, they don't have any planning. The educational side, they want to make standard of education by standardizing the infrastructure and college and standardizing the old qualifications, removing and teachers training course. But they are not at all supporting and they do not know that the teaching, the degree competence have to be increased among the students and what students have to be taught. How this knowledge will progress, how this knowledge will convert into healing, how the healing will take place, how the cure will take place, what to do, why this knowledge, the physician knowledge, we are giving so many things to homeopathic doctors, why they are not in a position to reciprocate the same knowledge into practical terminology of providing health or healing the disease, why the degree is not competent enough. Why the homeopathic doctors are not attending IAS, IPS, UPSC examinations, but how they are very successful with allopathic practice in private nursing homes. Our Commissioner of Homeopathy has not done any study despite why a homeopathy BHMS graduate will be paid 20,000 rupees and he will do nighttime practices. Though this is practically known, they are not bothered. They are open college. They are producing. They are giving qualification. They are giving degrees. They are pushing the students from the college because they made him to develop lack of confidence. He is joining in a nursing home. He is earning. He is writing wonderful prescription. His case sheet knowledge, his philosophy knowledge, his materia medica knowledge, his repertory knowledge, he is helping the allopathic hospitals, nursing home. So they are trusting and believing. And they are entering into surgery. They are doing wonderful surgeries and they are assisting the surgeons. And the surgeons are very happy. Recently, I found one homeopathic doctor. When I have taken one of my patient, I accompanied the patient. I have gone to a private hospital. There are private medical colleges, 8 private medical colleges in allopathic system of medicine in Pondicherry. So, for my surprise, he has to be passed catheter and angiography has to be done. So when the angiography has to be done, the cardiologist is there. Besides, I told I am a cardiologist, knows me. He introduced me. Then the cardiologist assistant told, sir, I am a homeopathic doctor. I passed from somewhere in Bombay. So I am doing his assistance. And that fellow passed the catheter. And for me, surprising thing is, the person who is a cardiac technician, he is from Singapore and his assistant is another homeopathic doctor. Then my immediate worry is how much you are paid. Then he told, sir, what you think? I don't know. I told that you may be earning 50,000. No, sir, my cardiologist gives me 1 lakh rupees per month. And I told the technician, sir, he is the only cardiologist, but I will get 6 cardiologists catheterization. So I am giving my assistant 1.25. Then I asked the cardiologist, what are the charges you will take? He told that I will take 3.25. 50% goes there, each catheter, each I will get 50,000. I will do daily 5 angios.
Okay,
and I
sir.
will pass 5
Okay,
steps.
sir.
So this is the
Okay,
style.
sir.
See,
Okay,
the failed homeopathic doctors in our institutions are highly successful homeopathic doctors in allopathic institution. The reason is our philosophy, organon, materia medica, and the knowledge that they are gaining through homeopathic subjects. So kindly keep this in mind and kindly give your proposals and make it make it a representation. I will send you the policy generations. You kindly send through association the policy generation to the Government of India, Ministry of Health, Ministry of Ayush, and Homeopathic Medical Commission and CCRL. Thank you very much.
thank you.
Thank you,
Yes,
sir.
yes, it is the time for discussion.
Hello.
Sir, it was really a brilliant session. Even though you have made a big presentation, the problem is that still people are struggling to get practice, the private practice, because we know that the only 10% of doctors are getting
Hello.
not even. Can you hear me, sir?
Yes, sir.
Only very few doctors, not even 10%, only five.
You are right, sir.
Less than 5% of
They
doctors.
are opening homeopathic clinics, but rest of all are busy with allopathic clinics. Their subject is so nice that they are convincing allopathic doctors, but not
Sir,
because our homeopathy is not substantial.
sir, it is sir, please wait, sir. It is entirely different in Kerala, sir. Kerala people are not doing such things because we here we have
The rules are
we,
strict.
we have very good organizations and if at all a doctor try to practice those the other system, we people will ask them to vacate that system and come back to homeopathy. And now,
And because the college education is not up to the mark, sir, the young doctors are deviated, diverted. In
sir,
a,
what
they
we,
will
sir,
give advertisement.
sir, actually, what we need to do is not to simply research, sir. We need to
Ah,
give to accommodate our junior doctors and how we need to give them to a chance to study homeopathy with the experienced doctors. But
yeah,
the thing is that nowadays, a lot of doctors from different
that is
type of schools,
public-private
the
participation, sir. They have to learn. They have to be taught.
Sir, please wait. Saigar School, Dr. Shankaran School, like so many schools are coming and they are saying that you people have to undergo this kind of studies. But thing is that the student, the junior doctors are more finding it difficult in that way because they don't know which system to be followed.
Naturally, sir, when we have
Actually,
lacuna, we are giving opportunity for schools to open like that.
so what we need is that we need to give the guidance to them. We need to
Yes.
take them to our junior, senior doctors and
Yes, this is where
motivate
of
them
school
to
finishing.
practice
You
homeopathy.
are
So
exactly right. That's why I told her school finishing.
yes,
Hello,
yes, yes, sir, yes, sir,
the school finishing mechanism all over the country by government of India is not present, sir.
yes, sir. Sir, let us as the time is over. I am inviting. We can invite Dr. Manoj to say a few words and conclude.
Yes, thank you, thank
So
you.
thanks to the
Thank you,
session.
Dr. Ganesh. Yes, of course. We must finish in time also. That's also a finishing school product should have been. Yes. Because
Finishing planning is not present like allopathy. What fourth year
please,
Sir,
goes?
please wait,
sir,
sir.
you are talking much. Please listen. That's also
Sir, please.
patient listening is also important. So please, sir, you have mentioned almost all things, and definitely you suggested a model how you can put into practice.
That is also present, sir. If you give, I have models now. Because of this, I am not in a position. If another 15 minutes, I need.
Always your presentation, you may conclude the presentation with 45 minutes there, so that we can have discussion. Otherwise,
Please,
how we can communicate with
Yes,
you,
sir.
sir?
Yes, sir.
you have
And
to make
Manoj said I have various advisors
Okay,
Okay.
for government of India with me,
thanks to Dr.
and I sent various things.
and all those participants in English session. Thank you, Dr. Ganesh, please.
Yes, Dr. Arya, Miss Arya, you can conclude the session.
Hello, sir. Thank you. Thank you for that wonderful section, Dr. Prakash Rao. As a student myself, after hearing all the conversations going on, I could myself say that we are, of course, in a dilemma, especially the young doctors, whether to continue in this stream itself. From what I have seen here, from what I've heard from my seniors as well as my teachers, motivation is also a thing. I'd like to thank, because our time is really short here and we have the other sessions waiting. So I'd like to thank all the participants present here and thank you everyone.